Namaskar. Myself, Dr. Lakshmi, Assistant Professor in School of Health Sciences, welcomes you all in today's teleconferencing session, which is for Certificate in Adolescent Health and Counseling Program students. They are teachers and any graduate as a parent. This program basically developed to make the learners aware about the growth and development, which is covered in Theory Course 1, and various issues and challenges faced by adolescent, which is covered in Theory Course 2. And in practical also, you all do the assessment just to identify whether the growth and development is normal. And very first performer, you assess the health assessment, in which you assess in respect of their weight, height, and overall growth spurt. In today's topic, we will be discussing the importance of nutrition and hygiene in prevention and control of tuberculosis. In Theory Course 2, you have a unit on nutrition in detail and health and hygiene. But in today's session, we will be discussing the importance of nutrition and hygiene in prevention and control of tuberculosis. And to discuss this topic in detail, we have an expert, Dr. Rita Devi, with us. I welcome you, ma'am. Dr. Rita Devi is having more than 30 years of experience, and out of which 8 years exclusive experience of working for TB. Ma'am, this session is for the CASC program, in which the teachers and the parents are the learner and they assess the adolescents. And sometimes adolescents have a problem, health problem, and they may have a TB also. So I request you, ma'am, first you discuss what is TB, tuberculosis.
Yes. Thank you, Dr. Lakshmi. As Dr. Lakshmi has rightly pointed out that nutrition plays very important role not only for the prevention and control of tuberculosis but for overall health, not only of the adolescent but the all age group. And TB being the disease which is infectious in nature, infectious means it can easily spread from one person who is infected with tuberculosis to the other healthy individual also. And this is also known as a preventable disease because it has got prevention, and prevention means your nutrition. How good is your immunity? That will prevent you from getting the disease. So it is a preventable disease. If you have good immunity by taking good nutritious diet, then you are not going to get tuberculosis. So it is a preventable disease. And second thing about tuberculosis, it is a curable disease. That means once you get tuberculosis, so you need not to worry much because you have 100% cure. There are good quality treatment which is available free of cost, and within a duration of 6 months 100% cure is also there. So there is no need to be anxious or worried or have fear that if you suffer with tuberculosis you will not get cured. So it is a preventable as well as curable disease, but at the same time why we are discussing it today, because it is the highly infectious. So, and one more thing you have to remember, as any age group, anybody can suffer with tuberculosis, including the adolescent age group also. So, as you know, the adolescent is between the 10 to 19 year of age is the overall adolescent age group, and out of that the population which is being covered by the 11% of the population is affected with the tuberculosis globally, and 1.1 million children and young adolescent aged under 15 years fall ill with tuberculosis. So it is not only that the older person is affected, but the adolescent can also get the disease. So if we want to see the TB is a common in adolescent or the especially in the older adolescent, because older adolescent means between 15 to 19 years of age group, with the estimated that 500,000 of the cases globally each year are with the tuberculosis among older adolescent, that is 15 to 19 years of age.
That means, ma'am, adolescents are also vulnerable and they also may have a tuberculosis as a disease. And you as a teachers also must have seen, and but as the social stigma is attached to this disease, and we are people are not exposing, but as madam has said, this is a curable and preventable disease. So ma'am, what all are the signs and symptoms of this disease, so the teachers will be able to identify?
Yeah, it is very important that as a teacher or a parent, you should know about the growth and development, as madam has told, about the adolescent age group also. And if there is some deterioration, you should be able to identify that what is happening to this adolescent. If you know, then you will be able to identify those symptoms. So the symptoms of presumptive tuberculosis, that means you presume that the child might be suffering with tuberculosis although he is not diagnosed. So what are these presumptive symptoms of tuberculosis? One of the most important symptom is the cough. If the adolescent is coughing for more than 2 weeks of duration, in spite of taking the medication, suppose every cough is not a tuberculosis cough. It is that you have coughing and you take medication, antibiotics for a 3 to 5 days course, and you get cured. So that kind of cough is maybe upper respiratory tract infection. But if after taking antibiotic again the cough is still persistent for more than 2 weeks, that means you need to presume that it might be tuberculosis. Then another symptom can be fever. Again, fever for more than 2 weeks duration, and also definite there is a weight loss and failure to thrive. That means if one adolescent at that particular age is having particular weight and the other adolescent who is not growing at all, his weight is stable at one point and there is no growth, so that is failure to thrive. At the same time, there is again, if you take the history of that particular child who is not able to gain weight, if you take history and you come to know that this child was in contact with some tuberculosis patient in past 2 years, not only 1 or 2 days, but in past 2 years also, if the child has exposed, that can be taken as a one of the risk factor, or you can presume that it might be that cough is due to tuberculosis. And another symptom is there is gradual enlargement of the lymph node, and especially if you see the neck region, there is a lump, or it can be swelling, or we say in local language एक गांठ उभर आती है neck region में.
Yes,
So
ma'am.
this can be tuberculosis. So this is even there can be swelling in the back of the backbone, that is called gibbous deformity. So these are the presumptive signs of suspecting that the child might be suffering with tuberculosis. So now we have to
And
see
ma'am,
how
these signs are visible also. As a teacher and parents, they are they can easily identify.
Yes.
And in the school, we maintain the record of weight monitoring routinely.
Yes.
Like, and in the report card also, we get the report card of our child, the weight monitoring is being done. So how significant it is, you can see that weight reduction is a very important sign of the tuberculosis. And along with that, if having cough for more than 2 weeks, so as a teacher, as a parent, it is very important that you should observe these signs and symptoms and immediately go for early treatment. So now how we can diagnose this, ma'am, further, this
Yes.
tuberculosis?
As we have seen the symptoms, you find out with the history of the child that he is coughing for more than 2 weeks duration, and you presume and you then counsel that child that you go for some diagnostic tests. So what are the diagnostic tests? First of all, in case of adolescent, the chest x-ray is done for all the children with the presumptive TB cases. As we have seen the presumptive symptoms, so that child should undergo chest x-ray, and the CB naught is the test which is given in the which is preferred over the smear microscope. Nowadays, previously, the diagnosis was used to be done with the help of sputum examination under the microscope. Direct microscopy was the test, but now as the good quality diagnostic tests are available, so CBNAT is the test which is done. And in case of children, it is very important. The next step is the gastric lavage, because these adolescent age group are not able to produce sputum. So in that case, so their content from the stomach is taken in the form of gastric aspirate and gastric lavage, and that fluid which is taken, stomach में से जो पानी लिया है, that has to be investigated, or the induced sputum. In case of adolescent, again this is another word I am using. Induced sputum means because they are not able to produce sputum, so they are given, first of here your role is very important, that child will say I am coughing but I have no sputum. So here is your role as a parent or as a teacher, that you have to tell how he will generate or induce sputum. You have to tell that you take steam inhalation first and take deep breathing, and after doing that deep breathing, cough out deeply to extract something as a sample. So that is called induced sputum, which you need to encourage them to give this sputum also along with the other tests. So that then the CBNAT test will determine that whether you are a confirmed case of tuberculosis or not. So with that, you can diagnose the tuberculosis. So you have to early identify the cases and then refer them for the diagnosis also, so that they can be confirmed case of tuberculosis.
So teachers and parents play a key role in sending the child for the early diagnosis and for early treatment.
Yes.
So, ma'am, before discussing the treatment part, at government level, we have programs just to prevent this tuberculosis also. Will you please explain in brief?
Yes. So, like there used to be National Tuberculosis Control Program previously, in which you must have heard that domiciliary treatment used to be the line of treatment, and in which patient used to come in the TB center for maybe 1 or 2 or 3 months of medicine used to be given, and patient used to take at home. But there was no check on whether patient is consuming the tablets or not. Later on, it was revised in 1997 as revised National Tuberculosis Control Program, in which many revisions were done to give the good quality treatment, good quality diagnostic tests, free of cost medication, as well as the health workers was responsible for the treatment of the patient. And again, now over a period of time, we keep on revising these national health program. Government of India keep on taking certain measures for the improvement of the population at large. So in order to address the gap in the pediatric TB coverage, or the pediatric means adolescent age group coverage, the National Tuberculosis Elimination Program, which has been started by Government of India in collaboration with the child health and the adolescent health programs. So these child health and adolescent health programs are specifically prepared by Ministry of Health and Family Welfare for the adolescent age group. So there are 2 primary health programs that serves the children and the adolescents across the country, and name of these 2 programs are Rashtriya Bal Swasthya Karyakram. Bal itself nominate the word adolescent. So Rashtriya Bal Swasthya Karyakram, and the other program is the Rashtriya Kishore Swasthya Karyakram. So Kishore is again an adolescent. So these are the 2 programs which has been collaborated with National Tuberculosis Elimination Program, and they are in collaboration working for the purpose to articulate the national policy for collaborative activities between the various health programs, that is NTEP, RBSK and RKSK. So they are working in collaboration so as to fast track the TB elimination, because our goal to eliminate TB is 2025 and it is just approaching in 2 to 3 years. So for catering to the adolescent need, along with this RBSK and RKSK, an anti-TB elimination program is working in collaboration so that no child is left without treatment and diagnosis, and they can be cater to the need of these children. So if we see Rashtriya Bal Swasthya Karyakram, it is the child health which emphasize upon the child health screening. And also when you have screened, that means you identify certain abnormalities in the child and you take early interventions like survival and improving the quality of life of children in the age of 0 to 18 years. So Rashtriya Bal Swasthya Karyakram, it caters from 0 to 18 years of age group, and there is a provision of comprehensive health screening. It is not that they are just screening for the cough only or the symptoms of tuberculosis, but they are screening for any comprehensive overall health of that adolescent, that you don't neglect his spiritual health as well as physical health, psychological or social aspect also. So
and other health problems which adolescent may
Yes.
suffer, that they are also
even mental health problem.
mental health
So
problem.
we have to see in totality rather than just one or two symptoms.
So, as a teacher and as a parent, it is very important that you should avail these services which is provided under Rashtriya Bal Swasthya Karyakram. And if you are a teacher, you can inform the parents regarding this program, so that they can avail these services and they can get the screening done for the children, for their children. So, for early detection for any of the disease, as Madam has said, it is not only covering the tuberculosis, it is covering overall growth and development and various health problems. So, ma'am, will you please highlight other
Yes.
screening done during under this program?
Yeah, yes. So for the prevention of tuberculosis, again there are 4 Ds. We say 4 Ds, or the 4 developmental delays, which need to be screened. As we have told that one of the aspect is screening. So what all to screen? First of all is the defect at birth. Many children, they are born with some or the
Yes,
other
ma'am.
genetic disorder. There is a finger is missing, or there is some deformities of the hands and feet. So that kind of defects at the time of birth, and they keep on going till the lifelong. So you can when you are doing general examination of the adolescent, that time also you can see whether every organ is intact, which you can see from the
Physical
while
appearance.
examining. So defects. Second D is for the diseases. Any diseases which is maybe genetic Down syndrome, maybe autism, or the kind of these diseases are prevalent from the mental retardation. So these are the diseases, second defect. Then third is the deficiencies. What are these deficiencies? Nutritional deficiency diseases. Like you must have read vitamin A, if it is deficient, that it can lead to night blindness. So same way, if vitamin D is deficient, it can lead to rickets, bone deformities. If there is vitamin B deficiency, it will lead to beriberi or thiamine deficiency. So every deficiency you must have in the theory also. You can go through again that these micronutrient deficiencies, even the protein energy malnutrition. There is deficiency of protein in the diet, or deficiency of carbohydrate in the diet, that can also lead to protein and energy malnutrition. So these are the deficiencies which you can assess, as well as the developmental delays. What is developmental delays? That means every normal growth and development undergoes various milestones. As we say, the infant start head holding at the age of 4 to 6 months, or maybe you can say that infants start walking at the age of 1 year, and there are certain milestones which has to be achieved at that particular age group. But in case of these children, they have developmental delays. So these you have to assess. Then how you are going to assess them? because children are in the community and they are not coming to you. So what the government has made the provision under this program is for the screening of these children for these developmental delays, the mobile health team. Mobile health team means this mobile team will go and find out these cases in the community based interventions. So RBSK is expected to perform comprehensive screening of more than 27 crore children in a phased manner. So this is how this mobile health team works, and it comprises of a medical doctor and ANM, that is auxiliary nurse midwife. Staff nurse can also be there, and a pharmacist in case some medicine has to be given. Suppose vitamin A dose has to be given, or the vitamin D is required to be given, calcium is needed, or some albendazole is required for deworming of the children. So that for that purpose, so then and there they treat, and screening of the children for health conditions as per their structural screening protocol. They have, checklists are being with them, so they can do that assessment and keep on ticking in the this screening checklist, so that they can identify what kind of developmental delay is present in that particular child. So screening is done at the Anganwadi center, because at village level the Anganwadis are available, and in Anganwadi twice a year it can be done, because it is not easy and it is not feasible also to take the mobile van. Transport is enclosed, manpower is enclosed, so it will not be cost effective that every time they are moving. So twice in a year they can do the screening for 0 to 6 year of age children in Anganwadi centers. Then at the government and government aided schools, where 7 to 18 years of children can be screened. So because as per the age that you have, school age children can be catered in the school, and those who are 0 to 6 year, they can be catered in the Anganwadi centers.
Schools are involved, and teachers, and even they take a consent of the parents. Due consent of the parents has been taken, and then the screening is being done, and even deworming is being done. And ma'am, another problem, they are suffering anemia. Is a very common in adolescents, especially in the girls. So I will be discussing that also, but as we were discussing, first program we have covered, and the second program under which government is doing is the Rashtriya Kishore Swasthya Karyakram, along with RBSK. So aim of this program is also to increase the availability and access to health related information to this adolescent population. If they are being guided in the right direction related to health related problems, and they identify what are the problems with which the adolescents are facing, that will help in generating the demand and to improve the accessibility as well as the utilization of quality counseling. So, and the health related services for the adolescents. So here you see that this Kishore Swasthya Karyakram is emphasizing upon the counseling for the adolescent. And why this counseling? For the health related information. If you as a teacher or as a parent, you are aware of this health information, then you can rightly guide the adolescent. Because sometime we have seen the behavior, if a girl is there and she is having dysmenorrhea, then she does not want to tell anybody that I am having this pain, and directly they go to the chemist to take some medicine. So they unnecessarily take the medication which she should not take. If somebody educate her or counsel her that this is the normal physiological process for which no medicine is required, and at this tender age if they start taking or developing this habit of taking painkillers, so that can be very harmful. So your role as a counselor is to guide them in right direction, that what is good for you during this period of time,
time and what is not. And also that it is not that it is only you are going to play your role as a counselor. It is kind of multi-sectoral
Yes.
coordination or multi-sectoral partnership to create the safe and supportive environment for the adolescent population in the country. So, as there are many things under this, the adolescent sexual reproductive health, that is called ERSH,
Yes, ma'am.
under the name ERSH, and then nutrition, as we are discussing nutrition, in which there are many aspects, like we will be covering in few other slides about anemia. We will take in detail then, but what all it is covering, first let us see the non-communicable disease. Adolescent is also, as these are the diseases of the adolescent, not the adolescent but the adults, but adolescents are also facing many problems related with non-communicable disease like child obesity, and the cancers, various cancers, and also substance misabuse. Nowadays, if you see, there are lot of many at the age of 13. This is the age where they are start taking these tobacco products as substance
Due to
misuse.
experimentation, you have read in your theory course, they are for during their cognitive development, they are prone to do experimentation and go into high risk zone. And for experimentation, they go for smoking, alcoholism, and substance abuse.
Yes. Apart from that, the RKSK is also covering the mental health and the injuries and the violence, because nowadays gender-based violence is also prevalent, and through a health promotion approach that can be cater. And there is a paradigm shift from the previously existing clinics and facility based approach, because every person who is sick supposed to go to the clinic. If adolescent is suffering with some gender based violence or some such issues, but he does not come to the clinic, so there should be a paradigm shift. If he, as a counselor, you have guided him in the right direction, that means that adolescent will come itself or herself or himself to the health facility, rather than you wait that somebody will take you there. So they take their informed decisions also.
So in the schools, we have a counselors, like if teacher has identified any child is having any problem, they immediately report to the counselor, and counselor approach to the adolescent and they call the parents. This protocol has been followed. But it is very important that you should be aware about the two program which has been discussed just now, Rashtriya Bal Swasthya Karyakram and Rashtriya Kishore Swasthya Karyakram, and various component. And you can make the parents aware of it. And further they can avail these services provided by the government.
At the same time, nowadays, as health and wellness centers have been established under Ayushman Bharat, so in villages itself, the adolescent health clinics are being organized in the health and wellness centers, and the trained manpower, that is community health officers, they are also being trained to organize adolescent health clinics. So if the adolescent is in the rural area, they should not feel, or they should not hesitate to go to these health and wellness centers to take the services, and they can find out when they are maybe in a monthly basis they are organizing adolescent health clinics. So there is a dedicated space for the adolescents in the existing health system at the level of district hospital, community health center, even in the primary health centers, sub-districts, sub-district hospital, district hospital, even in the medical college. So the adolescent clinics are available. This facility is available, so they can always approach. And dedicated counselors are available at the block level and at the community health center level and upward. So this is also a facility based intervention which they can avail for any time they have any problem. Apart from that, if madam was telling about peer educators, or there is a lot of peer pressure. So keeping that in mind, peer educators, or we say Satya, are the adolescents who are selected by the members of the village health sanitation and the nutrition committees in the village level. And what do we say a village? A village is where the thousand of population is available. There we say it is a village, and in that village there is village health sanitation and nutrition committee, and they also create peer educators, and every team of peer educator has 2 male member and 2 females. So they are together. Why these peer educators are created? Because if somebody else is guiding an adolescent, so they will not listen, but if their own fellow colleagues teach or tell them something, so they understand it more easily.
Yes,
so this is the concept behind keeping peer educator, and the motivation and the interest to lead such an activity is very important in these peer educator. They are the volunteers, they are motivators, they want to work for the cause of helping the adolescent, then they are being selected. So every village has at least 4 peer educator, and peer educators role is to promote early health seeking behavior. Here, early health seeking behavior is again if they identify certain symptoms, like today we are talking of tuberculosis. So if they find that you had taken antibiotics and you are not getting cured, I think you should go for some other checkup if your cough is not relieved. So they remain alert, and they can even tell you, guide you, and then you immediately take action. So that means with the peer educators help, you are immediately approaching and taking early intervention for your health.
That means, ma'am, these peer educators, they must be trained. They must have provided some training on different issues which are adolescents, like on drug abuse, on this gender violence, and on for example this tuberculosis, anemia. So they must have got training on it.
They must have got training, or they should be themselves interested in taking this task, like volunteers. There are so many volunteers nowadays available. Out of them they select, this village health sanitation and nutrition committee select 2. So they may rotate it later, and maybe they are organizing meetings in which certain topics are discussed, and that they impart to other adolescents. So they learn from each other.
So as a part of your practical, once you assess any of the problem, and you can always inform the parents when you are interacting with the parents, and in the school, if you are a teacher or the administrator, you can make a peer group in your own school also. You can train them with the factual information, and further these peer can educate their peer in the school as per the need of the adolescent. So, ma'am, we are
at the same time, yes, it is very important that adolescent health days are being fixed. As I was telling, the adolescent health clinics are dedicated spaces given for the adolescent health clinics. Same way, adolescent health days. AHD we say. So they can every village they can meet on quarterly basis, and then even parents can be involved, as stakeholders can be involved, school teachers can be involved in that, and they can discuss various issues. At the same time, these adolescent health days can also be utilized for the generation of awareness about tuberculosis again. Ma'am. So this way they can, and they are the motivator also, because TB is such a disease which is not curable within 2 to 3 days or 7 days.
Treatment is required.
Minimum 6 months of medicine has to be taken. So it is a long period for the adolescent. So during that period they have to undergo various growth and developmental changes are taking place. They are challenging with the menstrual hygiene. They are facing many other issues,
scholastic problems also they are suffering
scholastic with. Issue again. So for 6 months they cannot stop their life. So everything has to go along with this 6 months treatment. So that way your counselor has to play a very important role even during the treatment aspect of the adolescent. So as madam was asking about anemia, so I was stopping. Now there is a provision of weekly iron and folic acid tablets supplement in the form of supplementation, and this iron and folic acid tablets are given to the in the school, for both the school boys and the girls, and out of the school girls, and then biannual means every 6 months the albendazole is given in the schools to treat their worms or helminthitic control, because until unless the worms are controlled, then only iron folic acid tablet will be effective. So if albendazole is, you have to treat first with the deworming, and then you start with the iron and folic acid tablet for the prevention of iron deficiency anemia. So this is very important, because if the adolescent is anemic, anemia will again lead to lower immunity. And once the immunity goes down, the bacilli present in our body can also attack us, and we can get tuberculosis. So that I told you in the beginning, that if your immunity is strong enough, then you will not suffer with tuberculosis. So the program is being implemented across the country, in both in the rural area as well as in the urban areas. For albendazole, biannually it has to be administered, as well as then for weekly iron and folic acid tablets for the prevention, because anemia is prevalent all over India. It is an endemic disease. Throughout the year it remains. So we need to keep a watch on anemia first of all.
And moreover, adolescents are more worried about their body image and all, and they do this bodybuilding, and they take extra proteins, the ready-made proteins which are available. They are really playing with their health. So in our theory course, we have explained this is in detail, that they should take balanced nutrition and need not to take extra medicines and without any recommendation, and when it is not needed. So, ma'am, so till now we have discussed the government national programs, and for the adolescent, the Rashtriya Kishore Swasthya program and Bal Swasthya program, and comprehensively working for the better growth of the adolescent. And side by side, they are covering the tuberculosis. So let us come back to the program which is mainly for the tuberculosis prevention. What is the main goal of that program at national level, ma'am?
The main tuberculosis, as you know, that we have to identify at least 90% of the cases, and recently active TB surveillance was also going on to find out active cases of tuberculosis in door-to-door. Health workers were, ASHA workers or ANMs were going, and they were finding out active cases of tuberculosis. And every case which has to be diagnosed, after the diagnosis is made, it has to be notified. So until unless it is notified, it is very important to notify a case, because once it is notified, and suppose an adolescent has come across the tuberculosis, and she cannot stop her education for 6 months, as we were discussing. She has to go to school for some days till she is positive, and her treatment has been started, and after the treatment she undergoes follow-up sputum tests, and if the sputum from the positive it has come to negative, then she can attend the school also. And in the school, if she keep some teacher in confidence that madam, I am suffering with this thing, and teacher should support that child. So they should not make it a issue that now she is suffering, everybody should be away from the child, because now she is safe to come to the school, because she has started the treatment, she is taking good diet, balanced diet at home, and she can continue her studies in the school. And the role of teacher is here, she can also be Nikshay Mitra to that student. Nikshay Mitra is that she is supervising her medication, or she is reminding her every day whether you have taken your medicine today, so that she does not forget to take medicine, because nowadays the regime which is followed is daily dose.
Okay.
So every day student has to take medicine, and there is 2 months of intensive phase and 4 months of continuation phase. So but the difference between these two phases is that in the intensive phase she has to take that fixed drug combination is there, FDC, that is 3 drugs are there in one sachet, and they has to be taken on daily basis. And after she completes her 2 months of treatment, then she comes to continuation phase, in which one of the tablet is removed, and she will now take only two tablet in the continuation phase. But the whole treatment will go for 6 months duration, and teacher also has to encourage her, reinforce her, motivate her that she will be all right, because there are many role models
It
who
is
had
totally
suffered.
curable. It is totally
100% curable. That is why she can.
And all these
as
efforts.
along with this, it is very important that she is an adolescent, and she has to maintain her menstrual hygiene along
if
with
girl,
her
yes.
in the school also, or and it is a 6 months duration of the treatment. So then there is a scheme for the promotion of menstrual hygiene also, which is called MHS among the adolescent girls. And in this the 10 to 19 years of girls have given awareness about the various aspect of maintaining menstrual hygiene also, along with the overall health in nutrition, environmental hygiene, along with that menstrual hygiene, in which sanitary napkins are being provided, which are of high quality, and also they are being educated about how to dispose of these used napkins safely, so that environmental hygiene also she has to keep in mind. So this is also important for the adolescent. And why we are doing or taking all these measures to reduce the morbidity and mortality associated with the TB in children as well as in the adolescent population. And this we can achieve with the prevention control measures, with the early identification, as well as the prompt and complete management of the cases of tuberculosis.
So all these programs which we have discussed are mainly just to reduce the morbidity caused by the tuberculosis and other diseases, and especially like we are discussing tuberculosis, and mortality. If they are taking treatment and adhere to the treatment as mentioned by the doctor, if for 3 months or for the 6 months as recommended, then we can reduce the mortality caused by tuberculosis. And the three main aim are, we just want to first prevent it. Further, if it is there, we should do early detection and go for the proper comprehensive treatment. Ma'am, there are various strategies we are discussing in the prevention. In the prevention, what all efforts is being done by the government for preventing the TB?
One of the important thing is that anybody who is suffering with tuberculosis comes from the family. That family is from the society, and society constitute the community.
Yes, ma'am.
So it is very important, as a community-based interventions are very effective. So the one of the strategies enhancing the community awareness on tuberculosis.
Yes, ma'am. Very important.
And awareness means what? Awareness means how TB spread, how you will recognize the symptoms of tuberculosis, and if you recognize symptoms, how you are going to send that particular adolescent to the clinic for early diagnosis and treatment. So community awareness is important. And then generating demand and promoting the disease prevention and early health seeking behavior. It means that if an adolescent is neglecting nutrition, neglecting hygiene, neglecting her own environment, that and she is all the time keeping inside in a closed room, she is not going out at all, ventilation is not there in the house. So all these things you can observe easily. that what is the behavior of the child, whether she is taking normal diet or not. It does not require, if an adolescent has suffered with tuberculosis, she need only well balanced nutritious diet. And it does not mean that you have to take very costly foodstuffs. You can take what is available at home. At the dal, chapati, dahi, rice, salad, these things are around us and which are not very costly, but you can even add on to the nutritious value in this by keeping them in the sprout form. So like moong dal, kala chana, these can be sprout, and this sprout will add on to the folic acid value in the existing nutrient. So there are all, that means you have to consider all carbohydrate, protein, fats, micronutrients, vitamin and minerals.
So they should take balanced diet.
Well balanced
and
diet
they will
will
be able
cover-
to prevent, because
Yes.
their immunity will be enhanced when they are taking balanced diet, and when immunity is there, their body will be able to fight against tuberculosis.
Yes.
Right, ma'am?
Yes.
So another one preventive aspect is being offered by the government in the form of immunization, ma'am. Will you
Yes.
please explain that?
Yes, as you know that BCG you must have heard of. This is the first vaccination which is given at birth. Zero dose we say it. So BCG is the live attenuated bacterial vaccine which is being given for the prevention and control of, you know, TB is one of the killer disease. When we say जानलेवा बीमारियां, तो टीबी एक जानलेवा बीमारी है in children under 5 years of age. And what does BCG does? BCG provide protection against these जानलेवा टीबी. और वो जानलेवा टीबी कौन सी है? मिलियरी टीबी and tubercular meningitis, even disseminated TB. So these are the three killer form of tuberculosis. If a child under 5 years of age suffer with any of these tubercular meningitis or miliary TB, can be protected through BCG vaccination. So BCG का role is to prevent the child from this kind of severe form of tuberculosis.
And it is given at the birth and free of cost by the government.
Free of cost.
Yes.
It is free of cost at birth. It is given, and it will protect against. But you must have seen that there still TB cases are there. Still TB cases are there. Even we were protected with BCG vaccination, but everybody is suffering with tuberculosis because this BCG role is to prevent the severe form of disease. So जानलेवा से बचा लेगा वो बच्चे को.
And further, we have to work on our immunity, that means.
We have to keep on taking well balanced
Balanced
diet.
diet. So
you
our
know,
next
and
discussion
doing
will be
promotion,
on-
exercises,
Yes, ma'am.
Yoga. We can do yoga. Even children, yoga is very effective. So these are the health promoting measures which we have to do. Even like prevention from anemia is very important. Children will keep on playing in the soil barefooted and they will catch worms. And that can lead them to protein energy malnutrition. So we have to we have the role of if the undernutrition is there, that will again lead to diminished immunity, and once the immunity goes down, then it will lead to some or the other infection, and the most opportunistic infection out of all is the tuberculosis infection. And you know that BCG is given as a single dose at birth. So this is the message. And if some child is left not given at birth or some home delivery, although we don't promote home delivery nowadays, so as soon as the child is approached, he has to be immunized with the BCG vaccination.
So, ma'am, here, we have discussed that role of nutrition in preventive aspect.
Yes.
But if there is, a person is malnourished and if he has a TB, so there will be a adverse effect of it?
Yes. You know, if the child is malnourished, and of course malnourished hai, to they might suffer with the disease of tuberculosis. So what will be the effect? If the disease is there and the child is malnourished, there will be disease will be more severe. severity of the disease will be more, and increased risk of death will be there.
So nutrition is very important.
Nutrition plays very important role. If an undernutrition child has to be treated, so it is a double task for the health workers also, that every day you have to keep certain watch on that, and you have that heart palpitation whether this child will survive or not, because severity is so much. Child is not able to get up from the bed, is not able to take anything. So, and risk of death is always there if the child is undernutrition. This is the related with the disease. And if you see the effect on the treatment, if the child is undernutrition and treatment is going on, what will happen? So, in case of normal child, if the disease is there, sputum positivity rate, we say that you take 2 weeks of treatment and you will be negative. But in this case, where the child is already under nutrition, here there will be delayed sputum conversion. Sputum will not converge very easily, that now it is positive and you will come out with the negativity in 2 weeks. No, it will take long time for the conversion from positive to negative, and then risk factor for the drug induced hepatotoxicity will be more. If the child is undernutrition, as these tuberculosis drugs have very severe side effect on liver, they are very hepatotoxic. So in this case, if the child is already undernutrition, the liver will be more damaged with the undernutrition status. But a child who is good enough can survive this side effect also. So, and then malabsorption of rifampicin does not absorb properly in case the child is undernourished. It is during the treatment. And the reversion of positive culture to MDR TB, there is always a chance that if we are talking from positivity to negativity after taking treatment, but in the undernourished child, he is at risk. So instead of from positive he come negative, he can also undergo multi-drug resistant tuberculosis,
which becomes again risky.
So it is again, it can lead to death. So this is the reason that nutrition plays very important role in spite of disease or during the course of treatment. Then there will be effect on the long-term outcome, like the long-term outcome means, because I told that TB treatment goes for 6 months duration, and at the outcome, if the child was undernourished and he at least somehow completes 6 months of treatment, but outcome, at the time of outcome, he is again at risk of getting relapsed tuberculosis. That means एक बार तो ठीक हो गया, but within 1 or 2 months again he will come back with the same symptoms. So this is the problem with the undernutrition. And also effects on the contacts. What do you mean by contacts? Here, as we have not discussed this word before, contact means any person or the family members. One person is affected with tuberculosis and rest of the family members or whoever is staying with that tuberculosis patient, they are called the contacts.
Okay.
They are the contacts of that. So what will be the effect on the contacts? Increased incidence in undernourished contacts. If the contact is also undernourished, he or she will again suffer with the tuberculosis.
And sometimes they are not aware that they are contacts because people are not disclosing. But so from today's session, I think it is clear to all of you, it is preventable disease and it is curable disease. So need not to have that stigma that we should hide it. Rather, we should take early treatment as early as possible, and we should take a preventive treatment for contacts.
Yes.
That is also available.
That is also available. And if we come to nutrition aspect again, then reported effect of the nutrition support in TB patient, what will happen if you are supported, and government has made provision. Once you are notified case of tuberculosis, government is giving you 500 rupees per month for your nutrition, because when they are notifying you, that time they take account detail also, bank account detail also. So every month they put 500 rupees for your nutrition, so you can utilize that money for the Poshan Ahar Yojana. So
Government is supporting. Like
supporting,
Anganwadi also they are
yes,
providing in the school.
yes,
They are providing midday meal. Just to have
yes.
that point
Yeah,
in mind that
nutrition
nutrition is
is
very
very
important.
important. So what will happen with that? When the patient start with the treatment, then they start having, symptom also get improved. Like when they had weight loss, now the child will start having weight gain. And there is mortality, of course it will decrease, and there is decreased rate of unfavorable outcome. Like unfavorable outcome was death or relapse. So now it will not be there once the child has taken good nutrition, and there is also reduced risk of unsuccessful treatment outcome. So treatment will be successful, or as we have told that it is 100% curable
Curable.
disease. So if you are taking good nutrition with the along with treatment, that means there will be cure. 100% you will be cured. At the same time, you will be cured in that shorter duration of 6 months. Okay, so that is important, and your muscle strength will also, your power will also gain, and you will be just like an will be normal within 6 months of duration of that treatment, and you will again start your activities with full energy. So this is the power of nutrition, if even if you have suffered with tuberculosis.
So, ma'am, otherwise also we take nutrition to get energy, to get
Yes.
various nutrients like carbohydrate, protein, fat, and micronutrients. And if the person is having TB, they need it more in more amount and more quantity, and they should take it balanced nutrition. So, ma'am, now let us have a quick look on the importance of like hygiene, like
Yes.
basic measure for prevention of transmission
Yes.
from one
Yes.
person to another person.
Yes, very important, because as we know that mode of spread of tuberculosis is droplet nuclei, and when a patient is coughing, he is spreading droplet nuclei in the air, and we have to breathe in the same air. We don't know what we are breathing. So once the patient is a TB patient, he has to maintain, instead of personal hygiene, here we say respiratory hygiene or cough hygiene. It is very important. And what is it, cough hygiene? There are certain measures to contain or to curb respiratory secretions, or the coughing, or while sneezing, or while even talking or singing, or the patient is spreading these droplet nuclei in the environment. So he has to cover his mouth and nose. So nowadays, after COVID,
We have
masks are very common. So mask, he can use mask or the handkerchief, or he can use even a tissue. Or she can use a tissue. And in the school, because she is in the school whole day,
He or
so
she
she can use tissue also, and that can be taken safely. This has to be disposed of, and she or he should not spit here and there, wherever. So they should have a collection in some container, which can be boiled later on, and it can be disposed of safely in the toilets. And they also need to keep as we did in the COVID, hand
hand
hygiene
washing.
or hand washing using soap and water. So these are the various measures that need to be, and also they have to keep their whatsoever they are, like bedding or the pillow, which is the most often they are respirating on the pillow. So the pillow has to be, pillow cover can be washed daily, or it can be dried in the sunlight. And the bedding of the patient also can be exposed to sunlight, because sunlight kills this mycobacterium tuberculosis. So sunlight also play very important role. At the same time, your ventilation in the room should be there, and your well balanced diet. So these are the measures which has to be kept in mind when you are taking care of the patient. So you can use tissue, or as we have told, alcohol based hand rubs are also available, as well as There are soap you have to use for hand washing, disposable towels can be used, that depending upon the availability
Availability.
and affordability, so you can utilize. So making and separation of the person with the respiratory symptoms, because you keep some distance from the patient till he is positive. Yes.
So, thank you, ma'am. With this, we have finished today's topic, which is on importance of nutrition and hygiene in prevention and control of tuberculosis. So, I hope as a teacher and as a parent, you will support your students and your child for early detection, early diagnosis, and preventing the tuberculosis. Thank you, ma'am, for discussing this topic in detail. Namaskar.
Thank you.
डेवलपमेंट्स इन द फील्ड ऑफ पेंटिंग द सेकेंड पार्ट। टेली कॉन्फ्रेंसिंग के सेशन में हम लोग जो पेंटिंग के क्षेत्र में जो विकास हो रहा था या जो बदलाव आ रहे थे, जो परिवर्तन हो रहे थे, ख़ास करके 17th 18th सेंचुरीज़ में, उनके बारे में बातचीत करेंगे। इस पे बात करना इसलिए भी ज़रूरी है क्योंकि आमतौर के ऊपर इस पीरियड को मुग़ल डोमिनेटेड माना जाता है. इट हैज़ बीन डोमिनेटेड बाय द मुगल्स. That is there. We are not denying that the painting flourished under Mughals to a great extent. But we must not ignore or we must not undermine the presence of other traditions which were equally visible in different parts of Indian subcontinent. अर्थात हिंदुस्तान के और अलग अलग इलाकों के अंदर पेंटिंग को लेकर के, चित्रकला को लेकर के जो ट्रेडिशंस थे उन पे बात करना भी ज़रूरी है. नोबडी इज़ डिनाइंग द इम्पोर्टेंस ऑफ मुगल्स. वो है इम्पॉर्टेंट है, उनकी उन्होंने बहुत बड़ा पैट्रनेज दिया, and especially because they borrowed and extensively influenced by the Persian tradition, but they Indianized the painting also. उन्होंने हिंदुस्तान के हिसाब से पेंटिंग को मॉडिफाई भी किया था, जिस पे हम चर्चा कर चुके हैं. आज उसी चर्चा को आगे बढ़ाते हुए हम लोग आपसे ये शेयर करना चाहेंगे कि जो मुग़ल पेंटिंग का ट्रेडिशन था और जिस तरीके से मुग़ल डोमिनेशन था अक्रॉस नॉर्थ इंडिया एंड लेटर ऑन टू द एक्सटेंट ऑफ टू ग्रेट एक्सटेंट इन द ईस्ट इंडिया, इन द वेस्ट इंडिया एंड द साउथ इंडिया. तो जो मुग़ल का प्रभाव बढ़ रहा था उसकी वजह से जो मुग़ल स्कूल ऑफ पेंटिंग था उसका इंटरेक्शन भी हो रहा था, उसका बातचीत भी हो रही थी और स्कूल्स जो एग्जिस्ट करते थे. मतलब जो चित्रकला की और परंपराएं थीं उनसे जो मुग़ल ट्रेडिशन था उनका लगातार इंटरेक्शन हो रहा था, बातचीत हो रही थी और उसकी एक 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 एक, एक, एक तरीके का आपस में लेन देन चल रहा था. जिस लेन देन की वजह से, जिस इंटरेक्शन की वजह से, एक्सचेंज की वजह से दोनों परंपराएं समृद्ध हो रही थी. मुग़ल परंपरा भी समृद्ध हो रही थी और जो रीजनल ट्रेडिशंस थे या जो डाइवर्स ट्रेडिशंस थे वो भी समृद्ध हो रहे थे. तो दोनों को आइसोलेशन में नहीं देखना है, रहता दोनों को एक दूसरे के संग डेवलप होते देखा जाएगा तो समझ में आएगा आपको ज़्यादा आसानी से. Which means there is a kind of mutuality between the traditions existing in India and the traditions which Mughals developed and the traditions which developed under the influence of Mughals and as well as the indigenous traditions. तो इसका एक amalgamation हमको देखने को मिलता है जिसके ऊपर हम आज आपसे चर्चा करेंगे. मुग़ल पेंटिंग ने एक और काम बहुत महत्वपूर्ण किया था जिसके मद्देनज़र या जिसका असर हम बाकी दूसरे स्कूल्स ऑफ पेंटिंग्स पे भी देखते हैं. वो था कि जो कोर्ट लाइफ है, जो डेली लाइफ है, उसके ऊपर उन्होंने काफ़ी ध्यान देना शुरू किया था. जो पेंटिंग्स थी उनका जो चित्र होता था या उनका जो मुद्दा होता था या जो उनका मुख्य केंद्र बिंदु होता था वो कोर्ट में होने वाली एक्टिविटीज़ होती थी. अर्थात कोर्ट एक्टिविटीज़ वर गिवन वेरी इंपॉर्टेंट पोजीशन और इसलिए भी प्राइमरली ऑल्सो बिकॉज दे वर यूज इन द मैन्युस्क्रिप्ट्स. जो टेक्स्ट लिखी जाती थी, जो उनके ज़माने में तारीखें लिखी जाती थी या जो इतिहास लिखा जाता था, उनको चित्रित करने के लिए, उनको इलस्ट्रेट करने के लिए दे वर यूजिंग द पेंटिंग्स. तो जो कोर्ट में हो रहा है उसके इंपॉर्टेंट चीज़ों को डिस्क्राइब भी किया जाता था थ्रू द पेंटिंग्स. तो जो कोर्ट की डेली लाइफ है वो भी डिपिक्ट होती है. साथ ही साथ पोर्ट्रेट्स बहुत इंपॉर्टेंट कंपोनेंट रहा है मुग़ल पेंटिंग का कि पोर्ट्रेट्स बहुत डेवलप किए गए. पोर्ट्रेट्स मतलब एक व्यक्ति का चित्र बनाया जाने लगा और वो चित्र आमतौर के ऊपर मुग़ल बादशाहों के भी बनते थे. तो जो चित्र बनाने की परंपरा इसके अंदर एक व्यक्ति के ऊपर केंद्र करके आप बना रहे हैं उसको बहुत महत्व दिया गया. इसको एक और तरीके से भी समझाना चाहूँगा मैं. इसके पहले या इसके बाद भी या इसके साथ भी हिंदुस्तान में पेंटिंग का एक बहुत बड़ा हिस्सा पौराणिक कथाओं को डिवोटेड था. मतलब जो पौराणिक कैरेक्टर हैं, जो पुराणों में दिए हुए कैरेक्टर्स हैं, जो हमारे धार्मिक कैरेक्टर हैं, उनको डिवोटेड था. आप पूरी रागमाला की पेंटिंग देखेंगे तो आप उसको समझ पाएंगे कि किस तरीके से कृष्ण को दिखाया जा रहा है कि वो मधुबन के अंदर हैं और कृष्ण किस तरीके से अलग अलग रागों के अंदर वो किस रूप में नज़र आ रहे हैं वो देखने को मिलता है. तो दोनों चीज़ें देखने को मिल रही हैं. चित्रण पौराणिक जो कथानक हैं उसका भी चित्रण हो रहा है और जो रियल लाइफ सिचुएशंस हैं उसका भी चित्रण हो रहा है. सो मुग़लों के बाद चित्रकला में जो मेजर परिवर्तन आता है उसके अंदर रियल लाइफ की जो चीज़ें हैं, जो जीवन में घट रहा है उसका चित्रण भी होने लगा. मतलब जो इंडिजिनस ट्रेडिशन है, जो पारंपरिक चित्रकला की प्रवृत्तियाँ रही हैं, उनके संग जो बाहर की प्रवृत्तियाँ उनको मिला करके आप विकसित कर रहे हैं. इसका एक और आपको असर देखने को मिलता है कि जो माध्यम है पेंटिंग का और जो लोग पेंटिंग कर रहे हैं, अर्थात जो पेंटर्स हैं, जो चित्रकार हैं, वो चित्रकार मुग़ल इलाके के अंदर जो रहते हैं, वो जब रीजन से कोई आ रहा है, मान लीजिए आमेर के राजा या जोधपुर के राजा या डेक्कन का कोई राजा आ रहा है और वो मुग़ल मनसबदार में बन रहा है, मुग़ल सेवा में आ रहा है, तो उसके संग ये जो चित्रकार थे बेहतर पैट्रोनेज के लिए, बेहतर सुविधा के लिए या बेहतर सहयोग के लिए या बेहतर उनके वो जो लुकिंग फॉर द टर्म फॉर द बेटर पैट्रोनेज कि जो उनको ज़्यादा सपोर्ट दिया जाता था बाय द किंग, उसके लिए वो उनके संग चले भी जाया करते थे। मतलब जो मुग़ल कोर्ट के पेंटर्स थे वो धीमे धीमे और कोर्ट्स के अंदर भी जाने लगे, या मुग़ल कोर्ट के अंदर जो पेंटर्स उनकी चित्रशाला में थे, उनमें से कुछ जो हैं वो अलग अलग रीजनल सेंटर्स पे भी जाने लगे, वहाँ के राजाओं को ट्रेन भी करने लगे। एक बात और भी गौर करने वाली है कि जो मुग़ल मैन्युस्क्रिप्ट्स के अंदर चित्रण होता था, जैसा मैंने आपसे कहा कि दीज मैन्युस्क्रिप्ट्स आर इलस्ट्रेटेड, सो उसके अंदर नोबल्स वर आल्सो इलस्ट्रेटेड। मतलब जैसे आमेर के राजा हैं उनका भी चित्र बनाया गया है, जो जोधपुर के राजा हैं उनका भी चित्र बनाया गया है अंडर द मुग़ल पैट्रनेज। तो दोनों तरीके से परंपराएं चल रही हैं कि जो रीजनल क्षेत्र के लोग आ रहे हैं, क्षत्रप आ रहे हैं, जो वहाँ के राजा आ रहे हैं, उनका चित्रण आपको देखने को मुग़ल पेंटिंग्स में भी मिल रहा है, और उसका असर आपको रीजनल क्षेत्र के ऊपर भी देखने को मिल रहा है। हम जिन मुख्य चित्रकला के जिन मुख्य मुद्दों की या जिन मुख्य परंपराओं की बात करेंगे, वो मुख्य परंपराएं हैं प्राइमरीली जिसको हम कहते हैं किशनगढ़ स्कूल ऑफ पेंटिंग या डेक्कन स्कूल ऑफ पेंटिंग। जिनको हम किशनगढ़ स्कूल ऑफ पेंटिंग कहते हैं, उसको हम लोग दो हिस्सों में बांट लेते हैं, या जिसको पहले राजपूताना पेंटिंग कहा जाता था, राजपूत पेंटिंग कहा जाता था, उसको हम लोग अब फॉर अ बेटर अंडरस्टैंडिंग हम उनको कहते हैं किशनगढ़ पेंटिंग। और उसके अंदर हम दो मुख्य शाखाएं देखते हैं। एक शाखा हमको देखने को मिलती है जिसके अंदर राजस्थान और मध्य प्रदेश के इलाके के अंदर जो चित्रकला विकसित हुई, और दूसरा हमको देखने को मिलता है जो शिवालिक की पहाड़ियों में, जिसको हम पहाड़ी पेंटिंग भी कहते हैं, और हम डिस्क्राइब भी आपको उसको पहाड़ी पेंटिंग के रूप में ही करेंगे कि जो पहाड़ी पेंटिंग है वो भी राजपूत पेंटिंग का एक हिस्सा मानी जाती है, और जो किशनगढ़ पेंटिंग है जिसको हम किशनगढ़ पेंटिंग कह रहे हैं वो भी मानी जाती हैं। लेकिन दोनों की कुछ प्रवृत्तियां अलग हैं, जैसा कि आपको उनकी पेंटिंग से धीमे धीमे समझ में आना भी शुरू हो जाएगा कि जो पेंटिंग्स के स्कूल हैं कैसे मुग़ल इन्फ्लुएंस में भी हैं, जो केंद्रीय सत्ता है उसके इन्फ्लुएंस में भी हैं, बट साथ साथ अपनी क्षेत्रीय मौलिकता भी बनाए हुए हैं। The originality of the local tradition is also preserved, is also maintained by them. So we are discussing this interaction between the diverse traditions which are seen in the center or in the Mughal court, and the traditions which are developing or which were there in the diverse areas of Indian subcontinent. For example, Kishangarh, Pahari and the Deccan. किशनगढ़ पेंटिंग को लेकर शुरुआत में ये कहा जाता था कि ये हाईली सिंबॉलिक है, डीपली स्टाइलाइज्ड है, और अदर वर्ल्ड की बात करती है, इस दुनिया की बात नहीं करती, दूसरे वर्ल्ड की बात करती है। लेकिन अब जो नई पेंटिंग्स हम खोज रहे हैं, जिनके ऊपर हम लोग देख रहे हैं, जैसा कि आपको इस वक्त जो आपके पटल के ऊपर है या जो इस वक्त स्क्रीन के ऊपर है, इसके अंदर अदर वर्ल्डलेस की बात नहीं हो रही है, किसी दूसरी दुनिया की बात नहीं हो रही है, बल्कि राजा अर्जुन सिंह एक घोड़े का इंस्पेक्शन कर रहे हैं, उसको देख रहे हैं जिसके सारे उसको खरीद सकें। तो जो राजपूतों के अंदर दोनों चीज़ें आ रही, पोर्ट्रेट भी आ रहा है और साथ ही साथ जो रियल लाइफ सिचुएशंस हैं उनका भी डिपिक्शन हो रहा है, और जो पेंटिंग्स बन रही हैं वो बहुत ही ज़्यादा जीवंत बन रही हैं, बहुत ज़्यादा रियल लाइफ बन रही हैं, उसके अंदर अलौकिकता के उतना चित्रण देखने को नहीं मिल रहा है। तो जो परंपराएं हैं उन परंपराओं का समावेश आपको यहाँ देखने को मिलता है। मैं ये कहीं नहीं कह रहा हूँ कि जो पौराणिक कथाएं या जो पौराणिक कथानक का चित्रण होता था वो होना बंद हो गया, वो भी हो रहा है, वो रुका नहीं है, लेकिन साथ ही साथ पोर्ट्रेट और जो रियल लाइफ सिचुएशंस हैं उनका डिपिक्शन भी होने लग गया। जैसा कि अभी आपने देखा कि राजा अर्जुन सिंह जो थे वो देख रहे हैं पेंटिंग को, घोड़े को देख रहे हैं जिसकी एक पेंटिंग बनाई गई है। इसके साथ साथ जो हम पोर्ट्रेट की बात कर रहे थे, उन पोर्ट्रेट का जो राजस्थान में बन रहे हैं, दे आर ऑलमोस्ट इमिटेशन ऑफ द मुगल ट्रेडिशन, कि एक साइड में खड़े होके साइड का पोस्चर लिया जा रहा है, फ्रंट का पोस्चर नहीं लिया जा रहा है, साइड का पोस्चर लिया जाता है आमतौर के ऊपर, और उस साइड के पोस्चर के अंदर भी जो प्रोपोर्शन है उसको मेंटेन रखा जाता है। ऐसा नहीं कि प्रोपोर्शन को बिगाड़ने की बातचीत हो रही है, लेकिन जो न्यूएंसेस हैं, ये पेंटिंग मैं आपको तो अभी स्क्रीन के ऊपर दिखा रहा हूँ, लेकिन जो लोग इस पर काम करते हैं या काम करना चाहते हैं वो फिर इसकी बारीकियों को देखते हैं कि किस तरीके से कान के अंदर की जो तहें होती हैं उनको खूबसूरती से चित्रकार ने डिपिक्ट किया है, या जो उसने अचकन पहनी हुई है, या जो उन्होंने धोती पहनी हुई है, या जो कुर्ता पहना हुआ है, उसके ऊपर की जो सलवटें हैं उसको भी कितनी खूबसूरती से उन्होंने अपनी चित्रकारी के अंदर दिखाया है। मतलब जो डिपिक्शन है वो डिपिक्शन बेतहाशा रियल हो रहा है, साथ ही साथ जीवंत भी हो रहा है। लेकिन इसके साथ हमको ये भी देखने को मिलता है कि जो आइकनोग्राफिक ट्रेडिशंस हैं वो भी फॉलो किए जा रहे हैं। आइकनोग्राफिक ट्रेडिशंस के मतलब कि जो परंपरा से हमें मिलता आया है, जिसके अंदर ये बताया जाता है कि राजा के ये लक्षण होते हैं, चक्रवर्ती राजा के ये लक्षण होते हैं एक्सक्यूज मी, चक्रवर्ती राजा के लक्षण होते हैं और उन लक्षणों का डिपिक्शन भी किया जा रहा है, उन लक्षणों को आपको दिखाया भी जा रहा है। पेंटिंग के अंदर आमतौर के ऊपर देखा गया कि जो आंखें हैं वो ऐसी बनाई गई हैं कि जो एक कमल की पंखुड़ी के रूप में बारीक होती चली जा रही हैं, क्योंकि ये आइकनोग्राफी का हिस्सा है। ऐसा माना जाता था कि जो राजा होता है उसके लक्षण ये हैं, उसकी आकृति ऐसी होगी, उसकी आंखें ऐसी होंगी, उसके हाथ ऐसे होंगे। तो हमें रियल लाइफ के संग संग उनका जो आइकनोग्राफिक रिप्रेजेंटेशन है उसका एक अमालगमेशन देखने को मिलता है। एंड दैट इज़ वेरी वेरी इंटरेस्टिंग फॉर यू टू अंडरस्टैंड कि मुगल इन्फ्लुएंस के अंदर आप रियल लाइफ की बात तो कर रहे हैं, बट साथ ही साथ अपनी परंपराओं के अंदर जिस तरीके की आइकनोग्राफी मौजूद रही है, जिस तरीके की परंपराबद्ध तरीके से हम चित्रण करते रहे हैं, उसको भी यूज़ किया जा रहा है, उसको भी दिखाने की कोशिश हो रही है। तो एक दोनों के बीच में तारतम्य बनाते हुए, काइंड ऑफ सिंथेसिस डेवलप करते हुए, दे वर डेवलपिंग द पेंटिंग्स इन दिस एरिया। साथ ही साथ पेंटिंग्स के अंदर अक्सर जो राजा बनते थे या जिनका चित्रण होता था उनके बारे में एक देवनागरी के अंदर इंस्क्रिप्शन लिखा होता था या एक छोटी से उसके बारे में डिस्क्रिप्शन लिखा होता था, जिससे ये आपकी समझ में आता था कि ये किसके बारे में बातचीत हो रही है। जो पेंटिंग में कलर्स यूज़ होते थे वो पेस्टल होते थे, मतलब सॉफ्ट कलर यूज़ होते थे, बहुत ज़्यादा वाइब्रेंट, बहुत ज़्यादा बोलते हुए कलर इस्तेमाल नहीं होते थे किशनगढ़ पेंटिंग के अंदर। सटल पेल कलर्स यूज़ होते थे और बैकग्राउंड जो होती थी वो बैकग्राउंड हल्की सी पेल ग्रीन के अंदर रखी जाती थी, जिससे कि फिगर का जो कलर है, जो कथानक है, जो चरित्र है, उसका जो कैरेक्टर है वो उभर करके सामने आए। तो बैकग्राउंड को पेल ग्रीन के ऊपर रख करके उसके ऊपर आप पोर्ट्रेट बनाते थे, जिसके सहारे हाईलाइट ज़्यादा खूबसूरती से होता था कि एक पेल बैकग्राउंड के ऊपर आपने राजा का चित्रण किया और उसकी जो खूबसूरतियाँ हैं वो आपने उभार करके रखी हैं। जो पेंटिंग्स मैं आपके सामने इस वक्त रख रहा हूँ, इसके अंदर थोड़ा सा आपको यूरोपियन इन्फ्लुएंस भी देखने को मिलता है, क्योंकि जो ऊपर दो छोटे से बच्चे आपको दिख रहे हैं कि वो एक कालीन को पकड़े हुए हैं, वो दोनों एंजल्स को भी रिप्रेजेंट कर रहे हैं। सो ये वो समय है, जैसा मैंने मतलब जब हमने मुगल पेंटिंग की बात की तब भी हमने कहा था कि जो यूरोपियन इन्फ्लुएंस है वो भी आपको पेंटिंग के अंदर देखने को मिल रहा है। सो यही बात मैं आपसे कहने की कोशिश कर रहा हूँ कि जो पेंटिंग्स के डाइवर्स ट्रेडिशंस हैं, दे आर नॉट एक्सक्लूसिव, दे आर रदर इंटरैक्टिंग एंड डेवलपिंग इन म्यूचुअलिटी, एक दूसरे से तारतम्य बनाते हुए विकसित हो रहे हैं और ग्रोथ पा रहे हैं। इसी परंपरा में अगर हम थोड़ी सी बात आगे बढ़ाएं और कहें कि जिस तरीके की रागमाला पेंटिंग आज मैं दिखा नहीं पा रहा हूँ आपको, जो कि मेरे पास समय कम है, क्योंकि मुझे भी पहाड़ी की भी बात करनी है और डेक्कन स्कूल की भी बात करनी है, लेकिन जो रागमाला चित्रकला का ट्रेडिशन हमको देखने को मिलता है राजस्थान के अंदर, जिसके अंदर अलग अलग रागों को लेकर के नायिका और नायक का चित्रण किया गया है, उसके अंदर प्रकृति का भी बहुत खूबसूरत चित्रण आपको देखने को मिलता है। जब मैं कंक्लूड करूंगा तो आपको वहाँ के ऊपर एक दो रागनी की पेंटिंग देखने को मिलेगी, जिसके अंदर आप गौर कर सकते हैं कि किस तरीके से जो पर्यावरण है या जो प्रकृति है उसके सौंदर्य को भी बड़ी खूबसूरती से उभारा गया है। दैट इज़ द रियल लाइफ डिपिक्शंस, कि किस तरीके से रियलिटी और पुराण को मिला के या पौराणिक कथाओं को मिला करके जो चित्रकला में चित्रण हो रहा है वो अपनी रूट से भी जुड़ा हुआ है और जो नए बदलाव आ रहे हैं उनसे भी तारतम्य बनाता हुआ नजर आता है। अगर हम किशनगढ़ स्कूल के अंदर ही राजस्थान और मध्य प्रदेश से हटते हुए अगर हम पहाड़ी पेंटिंग की बातचीत करें तो वहाँ के बारे में एक बात आपको बड़ी इंटरेस्टिंग लगेगी कि यहाँ के ऊपर आमतौर के ऊपर जो पेंटर्स हैं या जो पेंटिंग्स हैं उनको हम पॉलिटिकल बाउंड्रीज में बांध के नहीं देख पाते हैं, क्योंकि जो पेंटर हैं वो पैट्रनेज के लिए एक जगह से दूसरी जगह जाते जा रहे हैं। और यहाँ के ऊपर जो पेंटिंग का ट्रेडिशन है वो पैतृक देखने को मिलता है, हेरिडिटरी देखने को मिलता है कि बाप से बेटे के अंदर देखने को मिलता है। तो जो पेंटिंग का परंपरा है वो बाप से बेटे के ऊपर जाती दिखती नजर आती है। एक बात मैं यहाँ पे कह देना चाहता हूँ, हम बहुत कंक्रीट रूप में ये नहीं कह सकते हैं कि जैसा कि मुगल पेंटिंग के अंदर होता था कि बहुत से आर्टिस्ट मिल करके एक पेंटिंग बनाते हैं, हम राजस्थान के बारे में बहुत श्योरिटी से बात नहीं कह सकते हैं, लेकिन पहाड़ी पेंटिंग के अंदर बहुत ज़्यादा व्यक्ति केंद्रित पेंटिंग होने लगती है कि एक चित्रकार है जिसको उसकी जिम्मेदारी दी जा रही है, चित्रकार को उसके लिए जिम्मेदार माना जा रहा है जिस पेंटिंग को बनाया है। मुगल के अंदर अलग अलग कंपोनेंट, पेंटिंग के अलग अलग तत्वों को अलग अलग पेंटर्स पेंट करते थे, इसीलिए आमतौर के ऊपर एक एक पेंटिंग के ऊपर कई कई आर्टिस्ट के नाम हमको देखने को मिलते हैं, जबकि पहाड़ी परंपरा में हमको देखने को मिलता है कि नहीं, यहाँ के ऊपर एक व्यक्तिगत पेंटर है जिसका पुत्र या उसका जो वंशज है वो उस पेंटिंग ट्रेडिशन को फॉलो कर रहा है। और पहाड़ी पेंटिंग के अंदर एक चीज़ और बहुत इंपॉर्टेंट देखने को मिलती है कि जो यहाँ के कलर हैं वो वाइब्रेंट होने लगते हैं धीमे धीमे। और इसके अंदर जो पौराणिक कथाएं हैं, जैसा कि किशनगढ़ में हो रहा था, जो पौराणिक कथाएं हैं उनका चित्रण भी हो रहा है और जो रियल लाइफ सिचुएशंस हैं उनका चित्रण भी हो रहा है। जैसे अभी जो पेंटिंग हम आपको दिखाने जा रहे हैं उसके अंदर जो बारात आई हुई है, किस तरीके से उस बारात के अंदर अलग अलग स्तर के ऊपर उस बारात को दिखाया जा रहा है कि बारात का एक हिस्सा दिखाया जा रहा है जिसके अंदर हाथी लेकर के आप कोर्ट किले के पखवाड़े किले के बाउंड्रीज के बाहर हैं, उसके बाद एक तल के ऊपर जो उसके आंगन में हो रहा है और एक जो महल के अंदर हो रहा है। तो रियल लाइफ डिपिक्शन को एक बहुत बड़े कैनवास को एक पेंटिंग के अंदर बांधने की परंपरा भी आपको देखने को मिल रही है। एक तरफ पोर्ट्रेट देखने को मिल रहे हैं तो एक तरफ बहुत बड़े कैनवास को आप एक पेंटिंग में बांधते भी नजर आ रहे हैं। इन क्वालिटीज़ की वजह से कि जो पेंटिंग्स डेवलप हो रही हैं वो पेंटिंग्स एक अलग करेक्टर लिए हुए हैं। जैसा कि पहाड़ी पेंटिंग के लिए मैंने भी आपसे कहा कि यहाँ बोल्ड कलर यूज़ हो रहे हैं और यहाँ के ऊपर जो पारंपरिक पौराणिक चित्रण है या पौराणिक कथाओं का चित्रण है वो भी हो रहा है, जिसका एक और नज़रिया अगर मैं आपको बताऊं तो पहाड़ी पेंटिंग को हम दो रूप में देखते हैं या दो परंपराओं में बांट के देख सकते हैं, एक तांत्रिक देवी सीरीज या दूसरी रसमंजरी ट्रेडिशन। दोनों के अंदर जब आप गौर करते हो देखते हैं कि जो अस्त्र हैं, जो शस्त्र हैं या जो वेशभूषा है वो पुराणों से भी बोरो की जा रही है। मतलब जो पौराणिक कथाएं हैं उनका चित्रण भी आपको देखने को मिल रहा है। खास करके जो कोर्ट ऑफ बसहोली में मिलती हैं, बसहोली एक जगह है जहाँ के ऊपर जो आपको पेंटिंग का ट्रेडिशन देखने को मिलता है जो बहुत मजबूत ट्रेडिशन है। उसके अंदर जो फिगर्स हैं वो हाईली स्टाइलाइज्ड हैं, मतलब ऐसा नहीं है कि बहुत ही रियलिटी में जा रहे हैं, रियलिटी के संग संग वो हल्की सी स्टाइलाइज भी हो जा रही हैं और एग्जेजरेटेड हैं। मतलब जिन तत्वों को वो हाईलाइट करना चाहते हैं उसके ऊपर बहुत ज़्यादा जोर भी दे रहे हैं, जिन तत्वों को दिखाना चाहते हैं उसको ज़्यादा वाइब्रेंट कलर से बना रहे हैं। मतलब पेंटिंग के सहारे ही वो एक उसके अंदर के जो अलग आयाम है जिनको वो प्रदर्शित करना चाह रहे हैं उनको वो ज़्यादा स्टाइलाइज करके आपके सामने पेश कर रहे हैं। सो इट्स एन एमालगमेशन ऑफ रियलिज्म एंड जो पौराणिक परंपराएं उनको मिल करके उनके सामंजस्य से आप मिल करके बना रहे हैं। साथ ही साथ हमें ये भी देखने को मिलता है कि जो पेंटिंग्स हैं उसके अंदर जो प्रकृति के तत्व हैं, जैसे कि जो पक्षी हैं या पशु हैं या जो विंग्स हैं वो बीटल विंग्स भी यूज़ किए जा रहे हैं। मतलब किस तरीके से बहुत बारीकी से जिस तरीके से पौराणिक कथाओं के अंदर एट्रीब्यूट्स दिए गए हैं कि इस व्यक्ति के संग या इस देवता के संग या इस भगवान के संग इस तरीके के एट्रीब्यूट्स यूज़ किए जाएंगे या इस तरीके से पहचाने जाएंगे। जैसा कि अगर मैं एग्जांपल दूं आपको, अगर सुदर्शन आपके उंगली में दिख रहा है तो आप पहचान सकते हैं कि फिर ये विष्णु की बात हो रही है, और अगर फरसा दिख रहा है तो आप परशुराम को देखते हैं। तो आइकनोग्राफी की जो ट्रेडिशंस हैं उन ट्रेडिशंस को भी बस होली में और जो पहाड़ी पेंटिंग है उनमें बड़ी खूबसूरती से यूज़ किया जा रहा था। साथ ही साथ कलर्स को बहुत बोल्ड यूज़ किया जा रहा था जिससे कि बहुत ज़्यादा वाइब्रेंट नज़र आती हैं। एक तरफ हमें पेस्टल कलर्स और पेल शेड्स दिख रहे थे अगर किशनगढ़ के इलाके में, तो इस इलाके के अंदर मतलब पहाड़ी इलाके के अंदर हमें ज़्यादा बोल्ड देखने को मिलते हैं, ज़्यादा बोलते हुए ज़्यादा चटक रंग देखने को मिल रहे हैं। इन्हीं परंपराओं को अगर आगे बढ़ाते हुए हम डेक्कन की तरफ चलते हैं, क्योंकि डेक्कन में भी एक बहुत मजबूत स्कूल ऑफ पेंटिंग डेवलप होता है, हम उसकी बात भी करते हैं, तो आपको ये बात थोड़ा सा गौर करनी पड़ेगी कि अनलाइक राजपूताना या अनलाइक शिवालिक की पहाड़ियाँ, जो डेक्कन है या जो हमारा दक्षिण भारत का इलाका रहा है या जो दक्षिण का पठार का इलाका रहा है, उसके अंदर बहुत पहले से बहमनी किंगडम डेवलप हो गई थी और बहमनी किंगडम वॉज ग्रेटली इन्फ्लुएंस्ड बाय द पर्शियन किंगडम। तो जो पर्शियन ट्रेडिशन है अगर मुगल में देखने को मिलता है तो वैसे ही कुछ ट्रेडिशन आपको डेक्कन पेंटिंग में भी देखने को मिलता है। जिन्होंने डेक्कन हिस्ट्री पढ़ी हुई है या जिन्होंने हिस्ट्री ऑफ बहमनी किंगडम पढ़ी हुई है या हिस्ट्री ऑफ उसके बाद के जो सक्सेस स्टेट्स हैं उनके बारे में पढ़ा है, वो जानते हैं कि वहाँ के अंदर एक बहुत मेजर ट्रेडिशन रहा है, बहुत मेजर कॉन्फ्लिक्ट भी रही है बिटवीन दी इंडियंस एंड द आउटसाइडर्स। विदेशी और जो देसी हैं उनके बीच में वहाँ कॉन्फ्लिक्ट बहुत मजबूत रही है। उसके अंदर एक और तत्व जो लगातार मिलता है, हम खाली बात कर रहे हैं पर्शिया और हिंदुस्तान की, बट पर्शिया और हिंदुस्तान के संग एबिसीनिया भी बहुत महत्वपूर्ण रोल प्ले करता है जब हम साउथ इंडिया में जाते हैं, हम डेक्कन के इलाके के अंदर जाते हैं, क्योंकि समुद्री मार्ग से अरब और अफ्रीका का इलाका बहुत गहरे तौर के ऊपर से दक्षिण भारत से जुड़ा हुआ था। तो जो पेंटिंग है वो दक्षिण की देखने को मिल रही हैं, वो बड़ी कॉस्मोपॉलिटन है, बड़ी मल्टीकल्चरल है। मतलब उसके अंदर आपको जो पेंटिंग का ट्रेडिशन देखने को मिलता है, जो डिपिक्शन देखने को मिल रहा है, वो डिपिक्शन खाली मुगल या देशज नहीं है, बल्कि उसके अंदर मल्टीकल्चरलिज्म है। एक ही पेंटिंग के अंदर अलग अलग तत्व आपको घुलते मिलते नजर आते हैं। और ये जो कॉस्मोपॉलिटनिज्म है, उसकी एक और बड़ी वजह है जिसको हम लोग आमतौर के ऊपर इग्नोर कर देते हैं या जिस पर हम लोग गौर नहीं करते हैं, वो है कि जो हमारा पेनिनसुला का इलाका है या हमारा जो डेक्कन प्लेटू और नीचे तक का इलाका है, ये समुद्र से घिरा हुआ, दोनों तरफ समुद्र हैं आपके पास, जहाँ से व्यापार बहुत ज़्यादा हो रहा है। तो व्यापारियों की वजह से विचारों का, पेंटिंग का आदान प्रदान भी हो रहा है। मतलब जो पैट्रनेज है, वो पैट्रनेज खाली पॉलिटिकल एलिट का नहीं है, बल्कि जो मर्केंटाइल कम्युनिटी है उनका भी पैट्रनेज बहुत ज़्यादा है। मतलब खाली रिलीजियस नहीं है, खाली पॉलिटिकल नहीं है, बल्कि कमर्शियल पैट्रनेज भी देखने को मिल रहा है कि जो बड़े व्यापारी हैं वो अपने यहाँ रख रहे हैं, पेंटर को हायर कर रहे हैं। तो जो उनकी डिमांड है या जो उनके एस्पिरेशंस है या जो उनकी अंडरस्टैंडिंग है, चूँकि वो घूम करके आए हैं बाहर, उन्होंने देखा है और ट्रेडिशंस को, तो उसका असर भी आपको डेक्कन में ज़्यादा देखने को मिलता है, बनस्पत किशनगढ़ के ऊपर देखने को या पहाड़ी के ऊपर देखने को। तो जो मल्टीकल्चरलिज्म है या जो 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 डाइवर्सिटी है, वो आपको डेक्कन की पेंटिंग्स के अंदर ज़्यादा देखने को मिलती है। और जो टर्किश ट्रेडिशन है उसको भी आप यहाँ के ऊपर देख सकते हैं। अब जो मैं पेंटिंग आपको दिखाने जा रहा हूँ, ये फेमस नोबल मलिक अंबर की है। मलिक अंबर की जो आप पेंटिंग देख रहे हैं, ये काफ़ी हद तक मुग़ल ट्रेडिशन से प्रेरित है, मुग़ल जो परंपराएं हैं उससे बहुत हद तक इन्फ्लुएंस भी है। लेकिन जो ड्रेस करने का तरीका है, उसके अंदर बहुत कुछ आपको डेक्कन का जो लोकल ट्रेडिशन है वो देखने को मिलता है। जो तलवार पकड़ने का तरीका है या जो तलवार उसमें दिखाई जा रही है, वो डेक्कन की दिखाई जा रही है। साथ ही साथ जो बटुआ उसके अंदर उनकी कमर पे बांधा गया है, वो बटुआ भी है जिसको हम पटकास कहते हैं। ये पटका भी एक अलग तरीके से बांधे जा रहे हैं। तो आप पोर्ट्रेट तो बना रहे हैं और पोर्ट्रेट बनाने में साइड फेस का इस्तेमाल कर रहे हैं, लेकिन उसके संग आप उसको अपने हिसाब से तब्दील कर देना, उसको अपने हिसाब से आप मॉडिफाई कर दे रहे हैं। वही पोर्ट्रेट बनाने का ट्रेडिशन जो आपको मुग़ल में देखने को मिलता है, पहाड़ी में देखने को मिलता है, किशनगढ़ में देखने को मिलता है, लेकिन जब वो डेक्कन में आपको देखने को मिल रहा है, तो डेक्कन की अपनी वेशभूषा के हिसाब से उसका डिपिक्शन भी धीमे से बदल जाता है और देखने में आपको अलग तौर पे नज़र आता है। एक और परंपरा इसकी बात करना बहुत ज़रूरी डेक्कन पेंटिंग के अंदर, वो है मैन्युस्क्रिप्ट इलस्ट्रेशन। मैंने पहले भी कहा था, मुग़ल के बारे में मैंने आपसे कहा था कि जो पौराणिक कथाएं हैं या जो फेबल्स हैं या जो इस्लामिक इलाके की जो पुरानी कथाएं हैं, उनका जब डिपिक्शन हो रहा है तो उसमें पेंटिंग्स का बहुत गहरे तरीके से इस्तेमाल किया जा रहा है और उसमें रियलिज्म भी आपको देखने को मिलता है, टेक्निकल प्रिसिशन देखने को मिलता है। आर्टिस्ट बहुत खूबसूरती से अपनी इंसाइट को यूज़ करते हुए सुल्तान और उनके लोगों को बना रहे हैं। सुल्तान को ज़्यादा मजबूत दिखाया जा रहा है, ज़्यादा बड़ा दिखाया जा रहा है, सबऑर्डिनेट्स को नीचे बैठा दिखाया जा रहा है। मतलब रियलिज्म भी देखने को मिल रहा है। साथ ही साथ आपको जो बारीकियां पेंटिंग की हैं वो बड़ी खूबसूरती से डेक्कन उसके अंदर देखने को मिलती हैं, क्योंकि यहाँ के ऊपर मल्टी कल्चरल इन्फ्लुएंस भी आपको देखने को मिल रहा है। तो जो मैन्युस्क्रिप्ट बनाने का, मैन्युस्क्रिप्ट को चित्रित करने का ट्रेडिशन है, उसके सहारे पेंटिंग काफ़ी ज़्यादा ग्रो करती नज़र आती है हमको डेक्कन के अंदर। और मैन्युस्क्रिप्ट के अंदर डिपिक्शन होने की वजह से उसका सर्वाइवल बहुत बेहतर हो रहा था, जिसकी वजह से आपको ये बात समझ में आने लगती है कि जो पेंटिंग है, पोर्ट्रेट भी पेंटिंग हो रही हैं, जो पेंटिंग्स हैं वो पेंटिंग्स आपकी पेंट हो रही हैं इन टर्म्स ऑफ पोर्ट्रेट ऑल्सो एंड इन टर्म्स ऑफ पौराणिक कथाएँ ऑल्सो, विच मीन्स कि जो बाहर से इन्फ्लुएंस आ रहा है उसको पूर्णतः नहीं स्वीकार किया जा रहा है, उसको बिल्कुल ओढ़ नहीं लिया जा रहा है, बल्कि उसको लोकल परंपराओं के हिसाब से मॉडिफाई करके, एकोमोडेट करके, एडजस्ट करके, और जो अपने कथानक हैं या जो अपनी परंपराएं हैं उनको यूज़ करते हुए हम लोग पेंटिंग को डेवलप कर रहे हैं। तो जो पेंटिंग के ट्रेडिशंस हम लोग को 16, 17, 18 सेंचुरी में देखने को मिलते हैं, कुछ हद तक मुग़ल से प्रेरित हैं, मुग़ल कुछ हद तक पर्शिया से प्रेरित हैं। ये ट्रेडिशन हमको डेक्कन में भी देखने को मिलता है, लेकिन साथ ही साथ जो लोकल ट्रेडिशंस हैं, जो लोकल रूट्स हैं, वो बहुत मजबूती से अपनी जगह बनाए रहती हैं और उन दोनों के सामंजस्य से हमें पेंटिंग डेवलप होती दिखती है। ये पेंटिंग जब मैन्युस्क्रिप्ट इलस्ट्रेशन के अंदर देखने को मिलती हैं, तब ये भी समझ में आता है कि कैसे लिटरेरी आइडियाज़ का भी एक्सचेंज हो रहा है, क्योंकि किस तरीके से जो फ़ारसी का लिटरेचर है उसको जब हम चित्रित कर रहे हैं तो कैसे हम अपनी पेंटिंग को उसके हिसाब से विजुअलाइज करते हैं। तो जो लिटरेचर और पेंटिंग के बीच का सामंजस्य का जो संबंध है वो भी बड़ी खूबसूरती से आपको इस काल की पेंटिंग के अंदर नज़र आना शुरू होता है कि जो इमेजिनेशन पौराणिक कथाओं में किया गया है, चाहे वो हिंदुस्तान की हो, चाहे वो पर्शिया की हो, चाहे वो अरब की हो, चाहे वो अफ्रीका की हो, कैसे उनको सब्सटेंशिएट करने के लिए पेंटिंग बड़ी खूबसूरती से अपनी इंसाइटफुल या पेंटर अपनी इंसाइट्स को यूज़ करते हुए उन पेंटिंग को उस मैन्युस्क्रिप्ट के हिसाब से डेवलप करता है या विकसित करता है। आखिरी चीज़ जो मैं इसके बारे में कहना चाहूँगा आप लोगों से वो ये है कि जो पैट्रनेज है उसने बड़ा गहरा रोल प्ले किया इन दी सपोर्ट ऑफ पेंटिंग। वो पैट्रनेज पॉलिटिकल भी था, मुगल मजबूत रहे, वहाँ से भी रहा। जो रीजनल किंगडम्स रहीं, जैसे जैसे वो मजबूत होती गई वैसे वैसे वहाँ के ऊपर भी वो परंपरा विकसित होती गई। चूँकि पेंटिंग को पैट्रनेज की ज़रूरत थी, ये पैट्रनेज उनको बहुत हद तक मर्चेंट कम्युनिटीज से भी मिला। तो जो पेंटिंग है वो अपने पैट्रनेज के हिसाब से उनके स्वादानुसार या उनके टेस्ट के हिसाब से पेंटिंग को मॉडिफाई भी करती रहती हैं। इसीलिए जो ट्रेडिशंस हैं वो डाइवर्स आपको देखने को मिलते हैं। आज हम लोग इस पे इतनी ही बात करेंगे। इसके बारे में कोई सवाल हो तो आप लोग बात कर सकते हैं। थैंक यू वेरी मच।
आइए अब आपको दिखाते हैं स्कूल ऑफ परफॉर्मिंग एंड विजुअल आर्ट्स की सहायक प्रोफेसर डॉक्टर मल्लिका बनर्जी द्वारा गाया एक गीत देश वंदना, जिसे लिखा है रविंद्रनाथ टैगोर ने।
সার্থক জনম আমার জন্মেছি দেশে সার্থক জনম মাগো সার্থক জনম মাগো তোমায় ভালো বেশে সার্থক জনম আমার জন্মেছি দেশে কোন দেশেতে জানি নে ফুল গন্ধে এমন করে আকুল কোন গগনে ওঠে রে চাঁদ এমন হাসি হেসে কোন গগনে ওঠে রে চাঁদ এমন হাসি হেসে আঁখি
আঁখি মেলি তোমার আলো প্রথম আমার চোখ জোড়ানো।
Namaskar. Dear learners, today we'll be discussing about the COP27 deliberations, 27th Conference of Parties to the United Nations Framework Convention on Climate Change. Today we'll see the deliberation that has taken place in the 27th COP meeting. So what all the things happened? What was the agenda? What was the path forward? Everything we'll be discussing today. Before that, I would like to stress why there is a framework convention on climate change. What is the background for framework on convention on climate change? If you look at it, the climate change as an issue was put into the political agenda only during mid-1980s. The basic reason was a lot of pressure, environmental pressure, environmental degradation, and a lot of awareness about the threats of climate change was known to the people, and that compelled the United Nations General Assembly to look into the matter, and thereafter important organization like World Meteorological Organization, they came with they established an intergovernmental panel on climate change, that is called IPCC, and with the basic objective of IPCC is to know the science of climate change, to assess the impacts of climate change, and to what extent human beings are responsible for causing climate change. So incidentally, the IPCC first assessment report that came in 1990, and it stated that human beings are responsible for causing climate change. And that was a period, because it's proved beyond doubt that human action is responsible. Economic activities of human beings are responsible for causing climate change. So United Nations General Assembly went for a kind of a grand negotiation and brought in a consensus to have a framework convention on climate change. And that was, in the year 1992, United Nations Framework Convention on Climate Change was signed, and it came into into force in the year 1994. In fact, if you look at the constitution of United Nations Framework Convention on Climate Change, in fact, almost all the countries are part of that convention, Framework Convention. And within this particular convention, if you look at it, the basic objective of this United Nations Framework Convention on Climate Change is to stabilize the atmospheric concentration of greenhouse gases in such a way that we'll be given the ecosystem to naturally adapt, the agriculture production system, or any, for that matter, any ecosystem to naturally adapt, and also in the other systems to have a resilient. So this is a very important objective of the Framework Convention. One is to stabilize the greenhouse gas concentration. The other one is a time frame is provided so that the greenhouse gas concentration is slowly and steadily it can be reduced, and simultaneously we can have an development which is more of sustainable. So sustainable development is another hallmark of the development practices, development trajectory that we wanted. So this United Nations Framework Convention on Climate Change, whether it has been implemented properly or not, what are all the steps have been taken, how the people or the nations or the countries, the parties to the Framework Convention, how they are acting, how they are implementing their climate policy, in order to monitor an organization or institution was established that is called Conference of Parties. And this Conference of Parties is very much inbuilt in the Framework Convention, and every year since 1995, if you see, there will be a Conference of Parties. I mean, this particular COP meeting, the heads of the government, they will be coming forward and they will be discussing each and every aspect of climate change, the science of climate change, what is the new development, how the climate policy is been implemented in each and every country, and in what way we can take the steps, proactive steps, so that we can contain the climate change. This is happening since 1995. If you look at it, where a lot of things have happened since 1995, the most important or landmark COP meetings are a few are there. One is the COP3, that is in the year 1997, in the month of December. The COP meeting was held in the place in Kyoto in Japan, and that led to we have come to know about the Kyoto Protocol, in fact. So that Kyoto Protocol is very, very significant as far as the climate change management is concerned. So in this particular Kyoto Protocol, it's again a very important thing, because certain things, if you look at the Kyoto Protocol, they were taking all the steps as far as the climate mitigation is concerned, and how best the developed countries can help the developing countries in terms of climate finance, in terms of technology, the transfer of technology, innovative green technologies can be transferred to the developing countries or vulnerable countries, so that those countries also will be in a position to reduce the greenhouse gas emissions from their actions, from their economic activities. That is the basic aspect of this Kyoto Protocol. So when you look at those Kyoto Protocol, the certain mechanisms are there in Kyoto Protocol. Those mechanisms were called as flexible mechanisms. So when you look at those mechanisms, one is the clean development mechanism, joint implementation, or emission trading. So in these three mechanisms, if you look at it, the developed countries were taking every step possible, to provide the best facilities possible to the developing countries, so that the greenhouse gas emissions can be reduced, and the finance part also. So every possible way, there's a kind of a kind of an hand-holding by the developed countries, and they were giving almost all support possible to the developing countries. But if you look at it slowly and steadily, the implementation of Kyoto Protocol is a very, very big question mark, because when you see, when you talk about the implementation, the finance is required. We have a structure, we have a framework for implementation, but at the same time, there is, many countries were not supporting, particularly the United States of America. They didn't ratify the Kyoto Protocol. However, the Kyoto Protocol came into existence, came into the force in the year 2005, because other countries were very proactive. They wanted to take all the steps possible to reduce the greenhouse gas emissions. So even though US was not part of Kyoto Protocol, but the exact the implementation part, if you look at it, it has been implemented. But when you look at those actions also, many things have happened since the Kyoto Protocol came into existence, 1997. So particularly the most key developments, let us see one by one. So the key developments, if you look at it, is the 2009 Copenhagen Accord. This is a very, very important meeting. In fact, 2009 Copenhagen Accord, basically it is a non-binding document. Nevertheless, it has given a benchmark for the humanity to what steps one can take to reduce the greenhouse gas emissions, and subsequently to reduce the increase in the surface temperature. It has given a kind of 2 degrees centigrade. That was the limit it has, the Copenhagen Accord has given. This 2 degrees centigrade is a very, very important thing, because when the surface temperature, if it is increasing, still further, so that can have a drastic effect on all the ecosystems possible. So in that is in order to contain that, so the scientific based on scientific principles, they have given this particular accord as set a target of limiting the global temperature, surface air temperature, to 2 degrees centigrade. So along with that thing, it has talked about the green fund also. When you talk about the green fund, so again the climate finance, how the developing countries will be getting access to the finance and access to the technology and the knowledge, service, climate information, everything possible. So this also has been discussed in the Copenhagen Accord. It's a very, very important thing, 2009 Copenhagen Accord. So later on, if you look at it, the Durban Conference is equally important. That was held in the year 2011, and that was in fact a point, slowly and steadily we started thinking about what next the Kyoto Protocol. After Kyoto Protocol, what will happen? What steps the United Nations has to take? So slowly and steadily, the Durban Conference and thereafter the Lima Call of Climate Action. So everything was progressing towards what? Paris Agreement. So in the year 2015, that is in the 21st Conference of Parties, Paris Agreement, that's a very important agreement as far as the climate change management is concerned, that came into existence. And when you look at the Paris Agreement, the foremost important objective of Paris Agreement is to reduce the increase in surface air temperature well below 2 degrees centigrade. That is the most important objective. And we will be also taking all the steps possible to keep this increase in surface air temperature well below 1.5 degrees centigrade as well. We will be taking all the steps possible. However, when you look at it in the last century itself, we have seen the surface air temperatures increase to 1.07 degrees centigrade. But however, we are taking all the steps possible. At least we have a benchmark of 2 degrees centigrade. So whatever the steps we are talking at, the management and the technology and everything. So we'll be having an idea that 2 degrees centigrade, that is a benchmark. We'll be trying to take the steps possible. So that is one aspect of the Paris Agreement, the objective of it. The second important objective of Paris Agreement is the Paris Agreement wanted the countries to go for more of mitigation and also adaptation. So adaptation finance came into picture because the countries, in addition to the mitigation aspect, we need to look for the adaptation also, because adaptation funding is equally important as far as the developing countries are concerned, or vulnerable countries are concerned, because they also need development, because they are definitely when they have the development, there will be a lot of the positive or rosy picture as far as the health of the human beings, health of the ecosystem, health of the country as well. So the sustainable, the development is most important thing as far as the developing countries are concerned. So for that purpose, the adaptation funding is also very much part of the Paris Agreement. The third important is the finance part. How the finance, the climate finance, the flow of money from the developed countries to developing countries. What kind of network, what kind of structure has to be there. That has also been well built in the Paris Agreement. So this Paris Agreement was, came into force in the year 2016. So thereafter, so whatever the steps we are taking, we will be having a benchmark as Paris Agreement. Okay, that is 2015 as a benchmark. So slowly and steadily, each and every year, we have taken a lot of steps. The last COP meeting at the Glasgow, Scotland, that is COP26, we have made, each and every country has made a lot of, commitments, has provided a lot of commitments, because that is very much part of the Paris Agreement, because each and every party has to have certain commitment to reduce greenhouse gas emissions, what kind of energy mixture, means I'm talking about how best we can go for renewable energy along with the fossil fuels, so more of renewable energy, and what kind of practices. For example, in our country, the Prime Minister Narendra Modi the Glasgow summit, he has given 2 or 3 important points. One is about the contribution of renewable energy into our energy mixture. You will be trying to increase the mixture, the proportion of renewable energy. And in fact, we are indeed, we must be happy, because we are in fact leading the solar alliance, because we wanted to capture or utilize more of solar energy. Along with that thing, we have started talking about the sustainable consumption or sustainable living. That is also very much part of the deliberations in the Glasgow. So having said everything, now we have to go for the COP27. So last month we had this deliberations in Sharm el Sheikh in Egypt. So this is a very, very important thing because to see the past, we have seen the past, and when you look at the present condition, certain key developments was there in, as far as the COP27 meeting was concerned. So the most important thing is that even before starting the COP deliberations, they said that it should be a this particular COP should be, COP means Conference of Parties, should be called as implementation COP, because they wanted kind of an implementation, they wanted kind of an action. Action means because the goal is in front of us, that is 2 degrees centigrade, but what at the ground level, what kind of action, what kind of measures we have taken, that need to be monitored, and that is very much the basic purpose of COP. That is, in fact, it is a supreme body. It deals with every aspect of implementation, and it also monitors each and every country's the communications. I'm talking about the it's called national communications, and also the greenhouse gas inventory. Everything will be monitored by the COP. And when you coming back to this particular COP27, the foremost important development was that loss and damage. That is the key development as far as the COP27 is concerned. COP, I'll just go to this particular slide and just 1 minute. This is a very important aspect. That is, for 30 years or 3 decades, the developing countries, vulnerable countries, they wanted, some kind of fund, because they are facing a lot of problems because of climate extremes or extreme weather events. The risk is more, and their damage is also extremely more. So they wanted kind of reparations or kind of a fund for their development. So for last 3 decades it was discussed, but incidentally in the COP27 meeting, it was definitely an historic development, because the countries have in principle agreed, both developed countries and developing countries in principle have agreed for a special or separate fund called loss and damage fund. This particular fund will be used for developing the vulnerable countries, and they will be providing a lot of support to those vulnerable people also, and developing countries also will be getting a lot of fund and incentives. So this is a very much an important aspect of COP27, because slowly and steadily, if you look at it, the climate change, the extreme events are occurring, whether it's Pakistan or Europe, in our country, Mumbai, everywhere we have we are observing, we are experiencing a lot of extreme events. So this particular loss and damage fund is very, very important thing. And along with that thing, when you talk about the fund, certain institutions have been also established, so that the particular purpose of this institution is to reduce the greenhouse gas emissions. So this is also very, very much part of the loss and damage fund. So the second important aspect of the COP27 outcome is the mitigation aspect. When you talk about mitigation, the foremost important thing is that we are reiterating, the COP27 reiterated the goals of Paris Agreement. So when you talk about the goals of Paris Agreement, it's well below 2 degrees centigrade. That is the basic goal. So we'll be trying to take all the steps possible to keep the increase in surface temperature well below 2 degrees centigrade. For that, we need to be more, active. And active means we need to take our efforts should be channelized, so that, or focused indeed, so that the increase in the greenhouse gas emissions can be reduced. So that is the most important aspect that has been discussed in COP27, and this is a very important thing, because when you look at the greenhouse gas concentration, the last year, if you look at it, that has been the highest. When I say highest, it has already reached a kind of a peak. Highest value was observed as far as the 3 important greenhouse gases are concerned: carbon dioxide, the methane, and nitrous oxide. They are 3 important greenhouse gases. Their concentration is very, very high, and it is in fact reached the highest in the last year. So having said this particular background, if you look at it, so we need to take the steps as much as possible, so that we can reduce the global net greenhouse gas emissions by around 43% by 2030 as compared to the 2019 levels. So this is very important aspect that has been discussed in the COP27. So another aspect is that it has been given, kind of a guidance. The COP27 has given a guidance to all the countries. Countries means the parties to the convention, framework convention, to bring in kind of an adaptation funding, a kind of planning in their national climate plan, so that their targets of 2030 targets can be materialized. When I say materialized, it should be more proactive, or not only proactive, because the planning, everything, the inventory, the architecture, everything has to be made in a proper manner, so that the goal of 2030, that targets that can be achieved. So each and every country has to take the steps possible. That has been discussed in the COP27. And very important aspect as far as the mitigation the domain is concerned, it is the fossil fuels. They wanted to phase down the fossil fuel use. Fossil fuel use phase down means they will try to reduce the use of fossil fuels, particularly the coal. So that is discussed in COP27, and simultaneously what we'll be trying to phase out completely the incentives or subsidies, inefficient fossil fuel subsidies, that will be also phased out. So one is phasing down, that is reducing the use of coal. The other one is, if it is very inefficient, the fossil fuel subsidies, everything will be removed completely, so that our focus will be more towards the renewable energy. So renewable means which is very sustainable, which is very green in nature. Green means, I mean, it's having a lot of nature orientations and everything. So in that way, that definitely will be helpful for the humanity. So this is with regard to the mitigation. The next is the adaptation. When you talk about adaptation, the COP27 has given a kind of a guidelines which states that the water, the subject means the water, it has to be integrated with all adaptation planning. When you say water, I'm talking about the water-based systems, ecosystems like your agriculture, the other lakes, water bodies, and everything. So that has to be integrated into the adaptation planning. So this is very essential to achieve food security, food and nutrition security, and also other benefits ecosystem services also will be getting, provided we will be in a position to mainstream the water sector into other adaptation sectors. So this is with regard to the adaptation. So next one thing is the climate finance. When you talk about climate finance, the accessibility is most important thing. In order to achieve in order to increase the accessibility, there was a guidance has been given to the financial institutions, international financial institutions, and also sorry, and also multilateral development banking systems, MDBs. So these banking sectors or international financial institutions, they have been given a kind of a guidelines. They need to reform their practices, and that is essentially the purpose is to provide easy access climate finance fund to the needy. That means developing countries will be getting more of fund. In fact, it has been suggested that by the year 2050, whatever the climate finance they're giving, it should be increased to 3-folds. So that is another key aspect of this COP27. So, and this particular fund also, it can be either in the terms of guarantees, it can be in terms of support, grants also can be given, or non-debt instruments also can be provided to the developing countries. So this is about the climate finance, because climate finance is going to be play a very important role in the coming years, because when you talk about adaptation funding, it requires huge amount of money, whether it's a developing country, in trillions it is requiring. So what is more important is that we need to somehow streamline, get a fund source, so that the developing countries will be getting the lot of fund, because that is the basic outcome of this COP27, because loss and damage fund. So the developing the vulnerable people require fund. See, other developments as far as the COP27 is concerned is to increase the investments and money flow to the renewable sectors like green hydrogen or renewable energy sectors or waste to energy technologies. So kind of a fund investment is required. So when you pump more of investments into these sectors, definitely their potential can be tapped, and that is indeed is a very, very important aspect, because we need to reduce the greenhouse gas emissions in the coming years, particularly in this particular decade. We need to, because the target is very huge, Himalayan indeed, but nevertheless, the steps, whatever the measures that has been highlighted in the COP27 is equally very, very important thing. So if you look at the another key development, that was the G7 group of countries, they came with the a kind of insurance system. It's called Global Shield. So that also is very unique because it is going to provide a lot of kind of an insurance facility to the developing countries. So having said everything what we have discussed in the COP27, certain expectations were there, and that was not met in COP27. One is the finance part, because they wanted more of money. The developing countries wanted more of money, but the kind of flow from the developing countries is very, very meager. And what steps need to be taken is that in the coming COP meeting, this will be discussed, so that the more of flow, the climate, what you call fund or finance, flows from the developing countries to the developing countries. That is one aspect. The second important aspect is that we need to phase down or phase out the fossil fuels. So because we are talking about the coal, we need to think about the oil and natural gases also. Slowly and steadily, we need to have a better mix, or giving upper hand to the renewable energy sectors. That will be very, very important in the coming COP meetings. That will be discussed. Indeed, COP28 is going to be held in UAE, oil-rich country. So this also probably will be discussed. So this is all about the COP27 deliberations. Indeed, it was a very important development, because the loss and damage fund is very important for the developing countries and vulnerable countries. Thank you very much.